So in stroke, there could be two different possibilities. A patient could have suffered a stroke because there's an obstruction of blood flow through the brain, or the patient is bleeding in the brain. So the treatment is going to be dependent on what is going on with the patient. So in our case study, the patient has suffered an ischemic stroke, and the onset of her symptoms has been less than 3 hours ago. So again, an ischemic stroke could be caused by a thrombus or plaque from atherosclerotic disease, or when there's hypoperfusion of the brain due to decreased blood flow, or when things are happening like heart failure. So in this case, the goal of treatment is to restore brain perfusion without causing reperfusion injury, to lower the metabolic demand of the brain, to counteract the ischemic pathways, to prevent another episode of ischemia, and to promote the tissue restoration. So once we know definitively that this patient is not bleeding, we would give them something called TPA, which is tissue plasminogen activator. This is given intravenously to a person who has had symptoms of a stroke of no more than 3 to 4.5 hours. So TPA, it activates the conversion of plasminogen to plasmin, which therefore helps to break down or dissolve clots and prevent the enlargement of an existing blood clot. This is a very potent drug, and a complication of its use is intracranial hemorrhage. In some cases, patients who come in with an ischemic stroke also present with high blood pressure, but the aggressive treatment of high blood pressure can further compromise the perfusion of an already compromised ischemic brain. In a hemorrhagic stroke, there's bleeding in the patient's brain. So this can be caused by a variety of factors. Things like high blood pressure, trauma, illicit drug use, aneurysms, or blood clotting disorders. It's important to know that regardless of the reason of why there is a brain bleed, our focus of treatment is to stop or reduce the bleeding. In addition to this, it's important to correct the patient's coagulation, to control the cerebral edema, to prevent a recurrence of bleeding, to reduce intracranial pressure, and to promote the restoration of tissue while preventing or controlling seizures. In some cases, surgical intervention may be necessary, and this is done to drain blood or to treat the causes of the bleed. And this would be in, for example, a ruptured aneurysm, or the patient may need microvascular clipping or an endovascular coil to stop bleeding. In the long term, patients who are discharged from the hospital after suffering a stroke are going to continue lifelong treatment with medications to prevent another recurrence of stroke. So these medications can be things like antiplatelets, like aspirin or Plavix to prevent blood clot formation, a statin such as atorvastatin to lower cholesterol, blood pressure medications like beta blockers, diuretics, or ACE inhibitors, and of course lifestyle modifications are also necessary. So if the patient smokes, they need to stop smoking, maintaining a healthy lifestyle, eating healthy, being physically active. And then another thing that we need to do is assess the patient's rehabilitation needs after a stroke.